Hello and welcome to another episode from this table of L Educates. I am Dr. Lukman Olushesi, the school doctor. Today we are going to be talking about pregnancy. We know that the news of pregnancy has always been the best of news, especially to expectant mothers or expectant couples. However, there are times that the news of pregnancy is followed by another depressing news. And the information would be that that pregnancy is going to be a threat to the life of the woman. What form of pregnancy is life-threatening? We're talking about ectopic pregnancy. So today, we are going to be looking at different aspects of ectopic pregnancy. We'll be talking about what ectopic pregnancy is, what are the signs and symptoms of ectopic pregnancy, what are the risk factors, what would make you predisposed to having an ectopic pregnancy, how is it diagnosed, what are the treatment options after the diagnosis, and of course, after all said and done, what happens after? All these questions and more are going to be answered in this video. Please stay with me.
I won't make it easy for you now. You got 2 minutes of my time, and I don't.
Welcome back. When you talk about pregnancy, what comes to mind is a normal pregnancy, which usually occur when a fertilized egg is implanted in the uterus, that is the womb, and the embryo that results from the fertilization begins to grow and grow until, the abdominal region of the pregnant woman, becomes this big. That is the picture of pregnancy that many of us have in our minds. All right? But in some cases, that is not usually the case. In a normal pregnancy, you have the fertilized ovum moving all the way to the womb, where it now gets stuck in the womb and begins to grow normally, because the womb itself is structured in such a way as to accommodate the growth of a baby. We have seen what happens. We have been able to describe what happens in normal pregnancy. Now, what is ectopic pregnancy? Whenever a fertilized ovum, like this one, did not, what normally happens is that the egg is fertilized here in the ovary, right? Now it moves into the fallopian tube and travels all the way through the fallopian tube into the uterus. Into the uterus here, right? Now, that journey, as short and as simple as that journey is, sometimes the fertilized ovum may not make it to the uterine cavity. It may not make it to this place. So sometimes the fertilized ovum gets stuck in the ovary and continues to grow. Sometimes it gets stuck at the beginning of the fallopian tube here. Sometimes it gets stuck. It can get stuck anywhere along the way. It may even get out of the womb and get implanted, within the abdominal cavity. All right? But the commonest area where we have ectopic pregnancy, or where we have pregnancy that is growing outside the womb, is within the fallopian tube, something like this. All right. And as you know, the fallopian tube is just like a conduit pipe. It's just like a connecting tube. It's just like that road that the fertilized ovum needs to take in order to arrive at the uterus. All right. Now, if you have the fertilized ovum getting stuck along the way, such a pregnancy is what is referred to as an ectopic pregnancy. Now, the question is, how do I know? How would I know that my own pregnancy is not normal? How do I know that I have an ectopic pregnancy? The commonest symptom is abdominal pain, lower abdominal pain. All right? The abdominal pain could be felt on one side of the lower part of the abdomen. It could be felt at the center. Sometimes the woman could be having, back pain. Sometimes there could be vaginal bleeding or spotting. You could have shoulder pain, which is what would be experienced when blood begin to trickle into the abdominal cavity and irritating some nerves. All right? There could be dizziness or outright fainting. There could be low blood pressure as a result of loss of blood. And of course, like I mentioned earlier, low back pain. If you look at many of these signs and symptoms, it looks very closely like the signs and symptoms of early pregnancy. All right? Now, how would you then distinguish? How would you know that, oh, this pregnancy is not normal? From what you have discussed as the signs and symptoms of ectopic pregnancy, and you may be wondering, what is causing all this? You say, imagine if a pregnancy is growing here. There's a limit to how much a fallopian tube can accommodate in terms of size of a growing pregnancy. So what will eventually happen is that the fallopian tube is going to rupture, it's going to burst, and then you will have blood oozing or leaking into the abdominal cavity. No matter where this uterus is embedded, if it is not within the uterine cavity that is structured and very well prepared to accommodate a growing baby, what will eventually happen is a rupture of wherever it is that the growing fetus got stuck along its journey from the ovary down to the uterus. So the pain, the spotting or the bleeding, depending on where the baby got stuck into. For instance, if the baby got stuck here at the neck of the womb, you would have bleeding, vaginal bleeding as the predominant symptom. But if the baby got stuck here and this part of the fallopian tube got ruptured, the blood is going to be leaking into the abdominal cavity. If it happens here and you have some of the blood escaping into the uterine cavity, then it might eventually pass out through the vagina, and the woman will be experiencing vaginal bleeding or spotting. So the reason for the pain and the bleeding, as well as low blood pressure and all the other symptoms, is as a result of rupture of the organ where the growing baby is forcing itself to grow within a very tight compartment, so which will eventually give way and bleeding will eventually occur. That is the main reason why ectopic pregnancy is actually a surgical emergency. Depending on the extent, we are still going to talk about the treatment options. Depending on the extent of the bleeding and the location of the ectopic pregnancy, it may be treated conservatively, or it may require urgent or emergency operation. This brings me to the risk factors for ectopic pregnancy. Why would a woman have ectopic pregnancy and the other woman does not? What are those things that will predispose a woman to ectopic pregnancy? The first thing is a history of ectopic pregnancy. If a woman has had an ectopic pregnancy before, the chances that she's going to have it again is much higher because of the damage that may have happened to the fallopian tube. All right, age is another factor. The older a woman is, the greater the chances of an ectopic pregnancy. And the reason is not far-fetched. The chances of infection is higher in older women because of the number of sexual exposures that they have had. It is also possible that such a woman may be on treatment for, infertility, or may have even had some procedure for infertility. This may also predispose such woman to an ectopic pregnancy. Infection of any kind, whether it's sexually transmitted or an abdominal infection or as a result of previous surgery, right, can predispose a woman to ectopic pregnancy. Smoking alters the inner lining of the fallopian tube, and the chances of a smoker having ectopic pregnancy is much higher than non-smokers. Previous abdominal surgery and an abnormally shaped fallopian tube or damaged tube are all factors that could push a woman to eventually experience ectopic pregnancy. Back to the question, how is ectopic pregnancy diagnosed? How would I know that I have ectopic pregnancy? Early in pregnancy, you want to do a pregnancy test. It could be a urine test or a blood test. All right? Now, if you have a urine test that is positive for pregnancy or a blood test that is positive for pregnancy, and you went ahead to do a scan, maybe at the 6 weeks of pregnancy or 7 weeks or 8 weeks, and the uterus is empty, despite the fact that you are pregnant, there is no sign within the uterine cavity that there's a baby there, then this is an indication that the baby may have gotten stuck somewhere outside the uterus. And so this diagnosis, in addition to all the other symptoms that you have enumerated, is actually a confirmation of the fact that you may be having ectopic pregnancy. So a positive pregnancy test in the presence of an empty uterus on ultrasound is almost diagnostic of ectopic pregnancy. Now, if you now have the other symptoms being present, low abdominal pain, vaginal bleeding or spotting, all right, there are some other tests that a doctor would do, in order to confirm that this person is actually bleeding inside. All right, all those things will be put together to make a diagnosis of ectopic pregnancy. Having confirmed an ectopic pregnancy, there are two treatment options. It could be handled conservatively, and you might have to go into surgery, depending on the location of the pregnancy, the ectopic pregnancy, as well as the extent of damage and bleeding. All right? If it is caught early, all right, there is an injection that your doctor might actually administer in order to stop the growth of that baby. All right, and over time, the body itself will digest and absorb the remnants. All right, this will require that you continue to do a follow-up until you have the green light from your doctor. And if the bleeding is obvious, you have a torn fallopian tube, you're bleeding inside, the bleeding is confirmed, then the doctor needs to go in to stop the bleeding and repair the fallopian tube. So those are the two treatment options. So you have had an ectopic pregnancy and it has been treated either conservatively or by surgery. The question is, what is next? The anxiety of an ectopic pregnancy will always be there. However, let me assure you that you can have a normal pregnancy after an episode of an ectopic pregnancy. All right? The other thing is that you may have to wait for about 3 months, all right, before you can begin to plan for another pregnancy. And the reason for this is not far-fetched. A fallopian tube has been affected and impacted by an ectopic pregnancy. It's been treated, you're fine, but the scar will still be there. So you want to give the body some time to heal. All right? So you don't rush into another pregnancy immediately after an episode of ectopic pregnancy. And it can happen if you do not plan it. You can get pregnant just immediately after an ectopic pregnancy. All right? Then the other thing that you need to know is that you can have a normal pregnancy with only one fallopian tube. There's a reason why every woman has 2 fallopian tubes. So if one has been irreversibly damaged or has been even removed because of, during the surgical procedure to treat an ectopic pregnancy, you still have one intact. You can't have normal pregnancy or pregnancies with one fallopian tube. So the important thing is that you want to discuss with your doctor about your future pregnancies after an episode of ectopic pregnancy.